Hi everyone, my name is Daniel Gover, and I'd like to spend a little bit of time speaking to you about how I've come to approach regenerating fenestration defects, especially at the time of tooth extraction. And in doing so, I want to show you how I've come to appreciate the flexibility of OsseoSeal as a membrane of choice over stiff membranes when regenerating these kinds of defects. So let's start with the case here. We have tooth number 7, which has an old root canal, old post, and crown. The tooth happens to be fractured, and you can appreciate both radiographically and clinically the area of infection at the apex of the root. So being able to observe this beforehand, we know going into it that once we take this tooth out and we clean out any of the granulomatous tissue, we're almost definitely going to be left with some kind of fenestration defect that we're going to need to address. So when I approach these cases, what I usually do is I'll extract the tooth, start cleaning out the area to the apex, feel around with my probe or instrument on the buccal plate for the area of fenestration, and then I'm going to design a semilunar flap to expose the fenestration defect, sparing the coronal gingival tissue. So that's what we're looking at here. The flap has been laid, the area has been cleaned out, and you can come to see the area of the fenestration that we need to address. Now in this case, and in a lot of cases that I do, I actually place the implant immediately into the socket. And what's neat about this is that you can see the threads of the apical part of the implant as you're placing the implant. And then we're going to go ahead and regenerate the defect over the implant. So in this case, I used a bone allograft called Dali mineralized cortical cancellous particulate in order to close up the defect and fill the area to encourage bone regeneration. And next, I'm going to use a membrane to cover this area and extend over to the bony margins so that we can encourage a true guided bone regeneration healing. In this particular case, I used OsseoSeal as my membrane of choice, and you can see how well this worked. OsseoSeal is really easy to handle, so usually I will trim it outside of the mouth, then I will carry it into the mouth dry and lay it on the area of interest. The OsseoSeal will then slowly absorb any of surrounding blood. You can even drop some saline or some local anesthetic onto the membrane, and as it absorbs the liquid, it actually drapes and sucks down onto the surface that it's placed. So in this case, it worked out perfectly. And what I want you to notice is especially the margins of the membrane, they're intimately adapted to the surrounding bone. There's no space in between there. So essentially the membrane is just literally adapting to the defect and the area of regeneration so that all of the margins are closed. And then it's very easy to go ahead and replace your flap. And suture the flap back at the margins of the incision to get a nice area of healing. So in this case, we were able to use the OsseoSeal membrane really well, and it was a perfect indication for something like this. Now I want to show you a different case with a similar presentation where I used a membrane that was much stiffer, different type of membrane from a different company. And I want to show you the struggle that I had when using it for this particular kind of case. So again, we'll notice that on the radiograph, there's a significant size periapical radiolucency, which is consistent with the swelling in the gingiva that we see closer to the apex of the tooth. So we know in advance that once we extract this tooth, we're most likely going to find some kind of fenestration defect. Same way, by extracting the tooth, cleaning out the area, detecting with our instruments the area of fenestration, and designing our semilunar flap around that area. So here you see the fenestration exposed and cleaned out. Again, I went ahead and I placed the implant immediately into the socket and was able to see the body of the implant being placed in the socket through the fenestration defect. We then go ahead and fill the defect in with a bone allograft particulate. You want to fill in the defect pretty intimately, and then you want to add some over to repair some of the contour. Now in this particular case, I used a different membrane, one that was much stiffer than the OsseoSeal that I showed before. And honestly, I regretted it. Same technique, trimmed it outside of the mouth, brought it to the mouth relatively dry, waited for it to soak up blood and start to get flexible and adapt to the area, poured some saline on it to have it soak up, and again try to adapt to the area, and honestly I couldn't. I tried to place it where I wanted it and it just wouldn't stay. It wouldn't stay, it wouldn't adapt. I ended up having to use sutures to mattress across just to hold it in place until I was ready to replace the flap. But what I want you to pay special attention to is the fact that if you look at the margins of the membrane, aside from just getting it to stay in the place that you want, the margins don't adapt to the surrounding bone. And so because it's so stiff, it just kind of stays in a horizontal plane, and you end up getting space in between the bone and the membrane, which is really not ideal for a regeneration procedure. So I definitely regretted using this at the time, but this is all I had. And I tried to position it as best that I could and adapt it as best as I could. And then I went ahead and replaced the flap with chromic gut sutures. In this case, just happened to have used a custom healing abutment for development of the soft tissue and some emergence profile for the future restoration. But the bottom line is I was frustrated using this membrane. I regretted using this membrane in this particular case. Certainly not saying that there's no indications special for this kind of a membrane, but it's not this case. And so just let's take a look again at the two membranes side by side. We have the OsseoSeal on the left, which is our quote-unquote flexible membrane that's able to adapt to the area, adapt to the contour that we intend. And then we have the other membrane that was used, which is much stiffer, that really was very stubborn and really wasn't able to give us what we needed for this particular situation. So this is one of the ways that I've come to appreciate the value of using OsseoSeal when repairing these kinds of fenestration defects, and something that I think is important to keep in mind when selecting membranes in general. Thanks so much for your attention. Any questions or comments, feel free to leave them on the website. Take care.